Hello, this is Dr. Rajagopal. Today I'm going to be talking about eyelid lift or tuck surgery, also called blepharoplasty. And obviously, since we have upper and lower lids, you can do either an upper blepharoplasty or a lower blepharoplasty, or do a combination of both. Generally, blepharoplasty surgery is one of the first surgeries that women or men address as they are aging. It's kind of one of the first facial surgeries that people come in concerned about. Most people come in saying, not that they want an eyelid surgery, but they usually come in saying, you know what, I look tired, I have droopiness in my eyes. Women come in and say that if they apply any makeup, they really can't really apply makeup. A lot of times the lateral part, that means the corners of the eyes start drooping. And that's usually concerns with the upper lid. In the lower lid area, it's usually puffiness. So people would ask, they say, the common occurrence is when they say, people ask me if I'm tired and if I've slept well, and I've actually slept well, but I still look tired. That's because of fat pads underneath the eyes. So upper and lower blepharoplasty are really addressing several factors. One is obviously some loose skin. Some patients have more loose skin than others, and so it depends on how much they have is how much you would excise. The second is you usually do in the upper lid, remove a little small strip of muscle, and then you actually look at the fat pads. In the upper lid, there are two major fat pads, one in the medial part of the eyelid, that means near the nose, and then that's one that's central, that's sitting more above the eyelid. And both those are addressed and trimmed if needed. And then obviously the skin is also excised, and then everything is sutured back together. So once the surgery is done, the eyes will look more open and more refreshed. Really, with both the blepharoplasty upper and lower lid, we do not want to change eye shape. So that's really important. We want to do a conservative look so they look better, they look rested, but you don't want to look like you've had anything done. With the lower lid surgery, again, we can go either make an incision underneath the lash line or go from inside the eye. Generally, for an older patient, I go underneath the lash line so we can remove a little bit of the fatty tissue and also tighten the skin. When someone is very young, in their 20s, and they have these bulging fat pads, and the skin quality is actually really good, then a great technique is going inside the eye, making an incision inside the eye, and then removing the fat, and then the skin shrinks back really well. So in a lower lid blepharoplasty, again, it's important to be conservative and not to remove too much skin or tissue so that the eye still looks nice and balanced.